Hello, welcome to this training module. We will be learning about service navigation and, more specifically, a study that focused on the perspectives of service navigators. This online learning module has been developed under the auspices of Federal Title IV-E funding, Minnesota Department of Human Services Contract GK 302. Module 1 will provide you with some of the background for this study, particularly as it relates to health disparities and barriers to healthcare access. Module 2 will focus on the scope of practice for service navigators, what service navigation is, and what service navigators do. And Module 3 will present the findings of the service navigation workforce study about the attitudes, perspectives, and need for training and resources of service navigators. So for now, let's focus on Module 1. We hope that by the end of this module, you should be able to define and give some examples of barriers to healthcare access in your community, as well as explain some of the causes of health disparities. And finally, you should be able to identify the challenges that families in Minnesota experience regarding their health and access to healthcare. First of all, what are health disparities? Health disparities are differences in health outcomes between two groups of people or populations, such that one group has poorer health outcomes than the other. Health outcomes can include a wide variety of measurable health factors, but commonly include mortality or morbidity from illnesses or injuries, incidence of chronic illnesses, mental health diagnoses or symptoms, or other preventable health outcomes or symptoms. Health disparities affect many often marginalized groups, such as Black and Indigenous people of color, people with disabilities, the LGBTQIA2S communities, people living in poverty, and people who live in rural areas. Some examples include the fact that among all those giving birth, Black women have the highest mortality rates. And people in the LGBTQIA2S communities tend to have more mental health symptomatology than straight cisgender people do. Finally, during the first year of the COVID-19 pandemic, people with intellectual and developmental disabilities were at the highest risk for being infected with COVID, and these disabilities were the second highest risk factor for death from COVID after age. Many researchers have attempted to determine why some groups have poorer health outcomes. There are many possible contributing factors. For example, the minority stress theory posits that the stress of experiencing discrimination and marginalization impacts the physical and mental health of those who experience this. Additionally, for groups that are economically disadvantaged, there may be environmental hazards, such as more harmful air pollution in poorer communities, leading to more respiratory health issues, or food deserts leading to problems with nutrition. Discrimination, such as racism or ableism in healthcare systems, can also mean poorer quality of care for people in often marginalized groups. Finally, it can just be challenging to navigate the complexities of the healthcare system to find the care that you need, especially when there are financial limitations, time constraints, linguistic and cultural barriers, and all the aforementioned other factors getting in the way. One major contributing factor to health disparities are barriers to healthcare access. Barriers to healthcare access are factors that prevent people from being able to obtain high quality healthcare. As mentioned previously, many factors can impede an individual or family's ability to access healthcare that they need. This can include barriers that are individual, like lack of transportation to healthcare appointments, or organizational, like a hospital system that does not comply with ADA regulations, community level, like sparse healthcare resources in rural communities, or systemic, like high rates of people without health insurance coverage. Now, for a moment, stop and reflect on what you've learned so far and how it applies to your own practice. What barriers to healthcare access do the children or families that you work with experience? Please pause the video here and either discuss this with anyone else you're watching this with, or you can free write or journal if you're watching it alone. All right, so let's discuss the challenges that families may face when trying to access healthcare. Some examples include lack of health insurance coverage, an inability to afford the cost of healthcare, whether a family has insurance coverage or not, Housing instability, which of course makes virtually everything more difficult, including scheduling and making it to appointments. Lack of transportation to get to healthcare settings. Difficulty finding providers with whom you can communicate in your first language, and or difficulty communicating with providers who only speak English, and lack of cultural understanding or cultural humility on the part of providers. As you might notice, these challenges reflect individual, organizational, community level, and systemic issues, and some are directly related to financial factors, whereas others are not. Pause for a moment and reflect on this list and see if any other examples come to mind from your own work or experiences. In the next module, we will learn more about how service navigators help individuals and families overcome all of these challenges that we've discussed. For now, we will leave you with a few more questions for you to discuss and or reflect on. First, how do things like housing or transportation affect or relate to mental and physical health? How does the work that you and or your organization do currently help eliminate barriers to healthcare access or reduce health disparities in your community? And how do you think you and or your organization could do more to help eliminate barriers to healthcare access? Here are the references for Module 1. Thank you so much for listening, and we will talk again in Module 2.